Okay, hello to everyone, dear. So in today's session, as it is written, we will gonna study about the anemia in pregnancy. So when you're studying OBG and all, so this topic is very important and kindly listen to the topic completely. So today we will gonna discuss about what is anemia, what is the classification of anemia, how the medicines are given during anemia and all. So let's start the session. So myself, Smita, welcome to my channel, dear, and don't forget to like my this video. So let's start the session. So जब भी बोलते हैं dear anemia in pregnancy, so have you seen in the clinical area like this? कभी देखा है अपने क्लिनिकल एरिया में ऐसे कुछ आईवी फ्लूइड में कुछ कलर चेंज करके पेशेंट्स को देते हैं? Yes, this is a form of anemia medication that is known as iron sucrose. Okay, so this iron sucrose are given in patient who are anemic, pregnant women who are anemic. So today we were going to study about it. Don't get tense. So let's start the session. So it has been seen that some area in the India are more prone to have anemia. Okay, उस एरिया में anemia के prevalence बहुत ज्यादा है. ठीक है, some tropical area and all. So this is the data is around in 2020 year and all. In the blood we are having various component. Okay, so these components, okay, like for example, the plasma, the heart component, every undergoes various changes. Similarly, the blood component, that is your HB, everything changes during the pregnancy. There's a hematological changes during the pregnancy. Okay, so we are having a RBCs. In the RBCs, this HB is bound to that. So the patient can have any kind of anemia perspective to, like for example, we are having classifications of anemias there. So it's according to the which kind of problem the patient is having, the patient will end up having anemia like that. So let's start with the basic. So all of you must be knowing how the RBCs are formed. Okay, so whenever there is a whenever there is a decrease in RBCs, or you can say hypoxia in the body, okay, hypoxia hai, the kidney will gonna release erythropoietin, okay, and this erythropoietin will gonna go and act on the red bone marrow, the site which is responsible for the RBC's production. So from there, the reticulocytes are formed, and ultimately the RBC is the mature form and which stays in the blood for around 120 days. And after that 120 days, it goes to the kidney. Kidney is known as the graveyard for the RBCs. So ultimately, these cycles goes on. So a patient will gonna have anemia regarding any kind of problem in this circle. Okay, so if a patient is having CKD, that's chronic kidney disease is there, so the patient will end up having anemia accordingly. CKD ka patient hai, chronic kidney disease ka. Okay, if a patient is having any kind of bone marrow problem, like for the patient of aplastic anemia, okay, they are very exposed to the kind of radiation. So ultimately, this reticulocyte formation will not going to take place. And then, if a patient is having any kind of severe hemorrhage, and the patient will gonna have, because of that, the anemia will be there. So there can also be anemia, hemolytic anemia. Okay, so let's move further. Having this concept in your brain, because we will start with A and then we will reach to the topic. So okay, so this is a kind of, you can say, a image, microscopic image of a patient who is having anemia. So you can see in the image here, we are having a peculiar image in this, the RBCs of smaller size, okay, and they are having very pale color in between that. This condition of pale color is known as a hypochondria. So the RBCs are small in size, that is known as a microcystic and hypochromic. Okay, so this is a peculiar image of a patient who is having iron deficiency anemia. So in iron deficiency anemia, you will gonna see a hypochromic, microcystic and hypochromic. So this is also an important view of point like that in for the exam. Okay, so let's move further. So let's talking about, dear, we should have A patient who is there in the clinical, we used to send a patient iron profile भेजते हैं. So in the iron profile, we are having a serum iron transferrin level TIBC. Always remember that this transferrin and TIBC's values are increased in anemia, but this ferritin level was decreased in the patient. Now let's talk about what is exactly is ferritin. The ferritin is nothing but it is a stored form of iron. बॉडी में जहां आयरन स्टोर के फॉर्म में होता है, घर में हम हाँ, आटा चावल खरीदते हैं, एक स्टोर्ड फॉर्म में होता है, एंड देन वी यूज टू यूटिलाइज लाइक इन द पैंडेमिक टाइम. तो दैट थिंग इज नोन एज अ फेरिटिन. फेरिटिन इज द स्टोर्ड फॉर्म ऑफ iron. Yes, बिल्कुल. So let's see. So like for example, this image you can see in the liver we are having the stored form of iron, and whenever there is a need for the iron formation or something, this ferritin is released. Okay. एंड ट्रांसफरेंस नथिंग बट इट इज काइंड ऑफ कैरिंग. बस में बच्चे बैठते हैं सुबह, स्कूल जाते हैं, तो वो जो बस का काम है वो ट्रांसफरिंग का काम है. कैन इमेजिन. ओके. सो एज अ होल वी गॉट एन आइडिया that the transferrin is nothing but it is a stored form of iron, whereas the transferrin is kind of help in transportation of iron to the exact places and all. So in anemia we are having a low level of ferritin. The stored form of iron is low in this. Is that clear? See, since we are studying anemia, we should have a basic concept and we are discussing about. So as a whole, now you people are clear. Let's see about the definition. So what is definition? Anemia? Anemia in pregnancy is defined as when the HB level is less than 11 gram per year. 11 gram per year से कम है. That is known as anemia in pregnancy, 11 gram per year, or the hematocrit is less than 33%. So that is the definition of anemia in pregnancy. Okay. So, like for example, dear, this is an image where we are having a value which is known as a MCH and everything. So I just want you to understand some values, and then we will gonna come to the classification. Okay, yes. For example, we are having a thing which is known as the MCV. And what is MCV is exactly? MCV is the size of the RBC. What is this size of the RBC is known as a MCV. If a patient is having low level of MCV, that means the patient is having microcystic related like that. If a patient is having high level of MCV, that reflects the size of the RBC. Is that clear? So let's talk about what is exactly is MCH. Okay, so MCH means, dear, mean hemoglobin volume. For example, I already told you in the starting that the RBCs carry some hemoglobin. Okay, so mean hemoglobin volume means how much HB is there on a RBCs. That is known as the MCH value. And then we'll talk about MCSC. That means mean hemoglobin concentration. If I'm having a glass of water, for example, this is a blood. This is 100 ml of blood. In that 100 ml of blood, the RBCs might be there. So as a total in every RBC is how much HB is there. So the average concentration of hemoglobin per volume of blood is known as a MCSC. Is that clear? So till now, we got an idea what is MCV, what is MCH, and what is MCHC. So whenever you're studying the report of a patient with anemia, you will gonna look to these values also. So let's come back to that previous slide. So now you can see that is written as MCV value less than 80 femtoliter cells. That means it is talking about this kind of size of the RBCs. Is that clear? So MCV value, the size of the RBC is low, and the patient will gonna have like anemia which is related to the iron deficiency की वजह से जो हो रहा है वो microcystic in nature, क्योंकि microcystic क्यों नाम दिया? Because of the size of the RBCs. Is that clear? So if you can see this is iron deficiency anemia now. Okay. Similarly, if a patient is having the normal level of MCV value that is ranging from 80 to 100 and all, but still this is normal, but this can be increased in number. That reticulocyte, that immature can be increased in number. So agar wo high beta high hai, that means a patient might be having a sickle cell disease. So sickle means there's a sickling of RBCs are there, but it is of no use. They are not carrying any kind of oxygen and all. So that is sickle cell. Okay, so till now I studied microcystic kind of and normal cystic and then macrocystic. In the macro means MCH value is more than 100. That means this much big. Okay, so इसमें classifications आता है like megaloblastic are there, and all this big size of MCV happens because of the patient is having you can say folate deficiency or pernicious anemia. Okay, let's move further. So in pregnancy, dear, in the pregnancy, so now in this image you can see, now you should be very clear with this slide that if a patient is having iron deficiency, means the patient is having microcystic and hypochromic. Microcystic, I already told you the MCV value like small, which only happen because of iron deficiency. Okay, so this kind of question has been asked in iron deficiency anemia. What will be the findings? Similarly, a patient, for example, let's talk about the vitamin B12 deficiency. There, the microscopic thing will be like macrocystic, means MCV values high macro, big. Okay, and normocystic, like for MCS values normal. Okay, I already told you what is MCHC. The mean volume of RBCs is 100 ml of mean volume of HP in the 100 ml of RBCs. That is known as the MCSC, mean corpuscular hemoglobin concentration. So let's move further. So यहाँ पे हमने एक क्वेश्चन कवर कर लिया about the iron deficiency. We are having microcystic and hypochromic. Let's move further. So talking about the anemia in pregnancy, major people, women when they are going through the pregnancy, they'll end up having anemia and all. So let's talk about the classifications. हम classifications की बात करते हैं. So number one is known as a physiological anemia. It all happen because of the hemodilution during pregnancy. That means the plasma volume increases and the heart component, that RBC, decreases, and ultimately the patient will end up having this physiological anemia. If I talk about the pathological, means because of disease condition, you can say, or something like a deficiency and all. So that is iron, folic acid, vitamin B12, or protein deficiency. And if it say hemorrhagic, the patient might be having APH or any kind of piles, okay, be bleeding piles. So she is having a low HP level. Okay, hookworm infection is there. Is that clear? So this was next let's have a discussion. Hereditary. Family में किसी को कोई blood disorders था because of thalassemia or sickle cell disease might be there. Okay, so patient might be having. So let's move further. There can be a more bone marrow insufficiency related to aplastic anemia, or the patient might have been like exposed to the radiations. Radiations expose the patient, and ultimately patient might be having the medicine which is known as aspirin. It has a side effect and all. Okay, so this is radiation. Okay. So already told you, in that cases, the patient end up having aplastic anemia. Anemia of infection, patient might be having malaria. So malaria consists of all those RBC cycles and all. Okay, तो उसके वजह से भी anemia हो सकता है, और patient might be having tuberculosis or sand fly, like for example, Kala-Azar disease during pregnancy. So these kind of anemia is more prevalent in the patient who are residing in particular places where malaria infection is high, or you can say Kala-Azar is high. Okay. Chronic disease, I already told you. The kidney is responsible for the formation of erythropoietin. So if a patient is having any kidney disease, chronic diseases and all, they land up having anemia. Hemoglobin malignancy. So the patient is having leukemia, cancer of the blood. They will also going to have, or hemolytic, where the RBCs are breaking too much. Okay. So let's move further. There are classifications of anemia. This is also a question of exam view of point. You can be asking what is the exact range if a patient is having severe anemia, moderate anemia. So mild means a patient whose HP lasting from value ranges from 9 to 10.9. A moderate, a patient is having from 7.8 to 9. A severe, a patient is very having HP less than 7. And very severe, that means a patient is having less than 4. So based on the classification, we need to give treatment or iron based on this classification. Okay, so if a patient is having very severe, we cannot give an iron tablet. That's the emergency because the HP is already less than 4 gram per day. Okay, so mild, moderate, severe, and very severe. Okay, you should not forget this classification. Now, the beautiful thing which I want to tell you that, for example, dear, let's have a discussion. All throughout the pregnancy, there is a total requirement of how much iron do you know? A total throughout the pregnancy, a mother needs around 1,000 gram of iron. And a total pregnancy is around of how many days? It is around 280 days. So what can be the total requirement of iron on a single day? So we need to divide it around 1,000 by 280. Okay, so it will be approx 4 to 6 gram per day. So don't you think we need to give this much of iron itself? Okay, the Government of India has launched a scheme which is known as Anemia Mukt Bharat. Under that, the woman used to get red pills and all. Okay, so let's talk about that. Okay, right. Till now, we got an idea a patient needs 4 to 6 gram per day iron. So, but we are giving a patient approx 60 gram of iron in a tablet. Okay, so why this 60 gram? Dear, and during pregnancy, how much the iron intake mother will be taking? Mother, she might be having green vegetables, anything. Only the 10% is only observed in the GIE system. 10% of the total iron is observed, that is 10%. So to reach that 10%, we used to give 60, then only the patient GI system will gonna have around 6 gram. Is that clear? So, so dear, so according to the Anemia Mukt Bharat, okay, we are giving this much iron and this much folic acid in one tablet. And that is 60 mg of iron plus 500 microgram of folic acid. Is that clear? The 60 mg elemental iron is, what is the form of this? That is a ferrous sulfate form. That iron is of ferrous sulfate. And always remember the iron, and always remember, dear, the iron which we are giving, it should not be started from the first time. So since the mother is already having a high level of acidity and she's doing vomiting, the taste of iron is too like bad. The approx third, second trimester and all we have to start. You can say from the 14 from the 4 month and all. Is that clear? So so we need to start iron. In the first trimester, the patient needs to take only and only folic acid because to prevent the baby from neural tube defect. Now, one more question arises that the folic acid has to be started prior to the pregnancy also before conceiving, and that is 400 mcg. Okay. So 1 month prior to the pregnancy and throughout first trimester, she will have to take the folic acid. So till now, if it is clear to you people, so let's see. You should also know that the folic acid is given to prevent neural tube defect. Okay, how a patient is gonna be identified for the neural tube defect? Test which is known as an anti-scan we used to do. Okay, at 11 weeks of gestation. That is known as an anti-scanning knuckle translucency scan. So we need to check whether the baby is having any kind of neural tube defect. So nape of the neck, under that the measurement is done. If it is more than 3 mm, that means the baby might be having a risk of and this neural tube defect and all. So let's move further. Okay. So ultimately, dear, if it till now that about the tablets were clear, we will have again the discussion. So this point I want to tell you, the plasma volume, the green, you can see this plasma volume is increases over the pregnancy, where the RBC value mass is like this one. This one is the RBC. So what do you think? So this will result in dilution. Hemodilution. Now you have got an idea that plasma volume during pregnancy increases and RBC mass, that heart component, is like, you can say, decreases. So ultimately the patient will have a physiological anemia during pregnancy. Okay. So, so let's talk about here. So this is a anemia Mukt Bharat. Under that, we are giving a 60 mg elemental iron to the patient plus folic acid, which consists of 500 mcg, and that has to be taken. Okay, and like from the second trimester, you can say, and okay, and it has to be continued till 180 days. That means the patient has to take the iron tablets after the delivery of the baby also, because the amount of blood loss during pregnancy has to be replaced. उसको replace करना है. Is that clear? So 180 days after delivery also, she has to continue taking the iron tablets. And always remember, between two pregnancy, there should be gap of at least 2 years. So आपको educate करना है एक mothers को about the contraceptive devices which she can go for. Okay, the benefit, the use, we need to educate to the patient. Okay, let's move further. So till now we are clear about what are the classifications and how the iron tablets are given during the pregnancy. Okay, so I already told you 1,000 gram of iron is needed throughout the pregnancy, and it is distributed. The fetal placenta is a 300 to 400 mg, where the, from daily urine skin loss is also there. It is around 250 and all. Okay. Lactation is 1 gram per day. How the tablet of Paris, the tablet looks like, and you should know in the clinical area also. So let's have a discussion to like other methods. Like this is an injection which is known as a iron sucrose, which I already shown you the image. So iron sucrose, dear, it is like given in a 300 ml of NS, and this single vial consists of 200 mg, and it is calculated how much amount we need to give. It is calculated by the weight of the patient and everything. Doctors used to calculate, and it is given. And one more thing I want to tell you, this iron sucrose, what is the indication? The patient who is not going to tolerate not taking those iron tablets, then we have to go with the IV. Okay, and always remember, dear, if the patient is taking iron tablets or IV, this thing, the HP is not like कि आज मैंने tablet खाया और कल बढ़ गया. ऐसा नहीं होगा. Okay, it will take some time, approx 3 weeks. The result you will gonna see about the 3 weeks of increase of 0.7 0.7 gram of HB over a 3 weeks. So if a patient is having iron tablets at 22 weeks of gestation, so after 3 weeks, if a patient at 22 weeks is having, for example, 8 gram HB. Okay, so 22, 23, 24, 25. So 25, you will gonna see the patient's HB of 8.7. So, and I want to tell you that how you will gonna confirm with the patient. ये patient बोली कि मैं तो iron tablets ले रही थी, साइज से मेरा HB नहीं बढ़ा, आपके iron tablets में कोई दिक्कत, तो we need to ask the patient what is the color of the stool. So the patient who is taking iron tablets, the color of the stool is black terry stool, you will gonna see. So it confirms that the patient is taking iron. तो आप पूछ सकते हो कि अच्छा आपने iron tablets लिया है, तो क्या आप बता सकते हैं color of stool क्या है? So you will get the idea कि whether she is lying or whether she is adherent to the iron tablets or not. Okay. Okay, so let's move further. So this is, you can say, ferric carboxy maltose. Okay, and even a patient is getting iron IV fluids and carboxy maltose, it's very important to see whether the patient might be having any kind of reaction. So particular monitoring of the vitals needs to be done. Okay, so these are the iron-rich diet which we have to educate the patient to take particularly. So now let's talk about. Okay, let's talk about the causes. The causes can be of before pregnancy or it can be after pregnancy. If we talk about the before pregnancy, the patient might be having a faulty diet. Means if a patient might be having high carbohydrate diet, okay, so the iron absorption you can say it's not good. A faulty absorption mechanism. If the patient might be having GI disorders, like okay, so the patient will end up having pernicious anemia and all. If a patient is losing iron excess, blood loss is there, or during menses, patient will have this problem or hookworm infestation. During pregnancy, how can she can lose this thing is by increased demand of iron because baby is also growing. Okay, and she's not taking iron well and disturb metabolism. She's not taking the iron tablets properly. Always remember, iron has to be given with vitamin C, not with the calcium. So we need to educate that patient that you should not take iron calcium at a single time. Okay, excess demand. So let's see about the clinical features. The patient will feel very much weak. Okay. And if we talk about the exam view of point here, exam to paler will be there. Okay, edema of the legs may be there. Okay, so for most important, the patient will have this kind of nails. This is an important area for the exam viewpoint. So this is spoon-shaped nail, which is seen in anemia coelonacea and all. See, this is glossitis, the first image. This is glossitis, which is seen in anemia. This is angular stomatitis. So you should know. Okay, this is also exam viewpoint. In severe form, we can go with the various investigations. We need to check for all the blood components. For example, I told you MCV, MCH हमें देखना है, patient के ferritin level देखनी है. We need, in the severe form, we can go with the bone marrow studies also. So complication, will be any complications to the mother? क्या हो सकती है अगर एनीमिया है तो कोई दिक्कत हो सकता है? Yes. It can be during pregnancy. Okay. So let us see what are the various complications. So sorry. So let's talk about during labor, it will be atonic in nature. The puparium, there will be a subinvolution. अच्छे से subinvolution हो जाएगा, नहीं होगा. Patient revert back puparium अच्छी नहीं होगी. Infection के chances ज़्यादा है. Patient is having anemia. Okay. If we talk about during labor, patient can have atony also. Okay. So ultimately, if anemia is there, there's an increased chance of infections. Okay, let's talk about if will be a complication to the baby. Yes, there will be a baby. So when you will see a baby whose mother is having anemia, it will be of IUGR क्योंकि proper oxygen उससे नहीं मिल रहा IUGR. और जब हम placenta देखेंगे ऐसी mothers का, it will be very small. It will be not a good healthy, you can say. Okay. इसीलिए हम लोग क्या करते हैं, देयर इज अ कॉन्सेप्ट व्हिच इज नोन एज अ डिलेड कॉर्ड क्लैंपिंग. ओके, इन देयर आर वेरी मे स्टडीज आर गोइंग ऑन जहाँ पे डिलेड कॉर्ड क्लैंपिंग करते हैं सो दैट द बेबी will gonna get more blood from the mother's side and can be prevented. We can prevent the baby from having anemia and all. Now let's have a test. Now we are clear what is anemia, what is with different types of anemia. Let's say now you will answer. So you are providing a diet plan with a low iron level, which food? Which food would you encourage the patient to eat? So ultimately, you have to educate the patient to add on with egg yolk and beef and legumes. So घर में जितने चना होता है, you can see increase in iron. So patient with a history with gastric bypass surgery 6 months ago, report feeling of very fatigue and is often having food craving for the clay and dirt. An assessment, you noted a spoon-shaped nail. Now you have to tell me spoon-shaped nail का दूसरा नाम क्या है? मैंने आपको इमेज दिखाई थी, dear. Yes, very good. It is coilonacea. Let's move further. A physician orders a patient with a suspected iron deficiency anemia blood cells. How would the red blood cells appear? So iron है dear, I already told you. कैसा होगा बताइए? Hypochromic and microcystic. The answer is B. ओके, हाइपोक्रोमिक मतलब छोटा आरबीसीज है, बट उसके जो इनर पार्ट में कलर बहुत ही कम है, दैट इज नोन एज हाइपोक्रोमिक. एंड माइक्रोसिस्टिक द एमसीवी वैल्यू इज लेस देन 80 फेमटोलीटर. तो आरबीसीज आर वेरी स्मॉल इन you can say size. Let's move the further question. So this is the education, and the patient is asking whether which among this education is like, you can say, it's wrong and all. So the answer is, so what do you think the statement the mother is telling? So I will avoid taking this medication with orange. So this statement by the patient needs a re-education. Okay, तो ये है इसका dear. The correct answer for this is B. Very good. So I hope so you like this session, and please do not forget to like my channel, subscribe my channel, and thank you so much, my dear student.